My name is Emma. I'm the lead chemotherapy nurse working here at Cambridge University Hospitals. I would like to welcome you to this film, which will explain how to prepare for your first anti-cancer treatment visit. Systemic anti-cancer therapy is a term used to describe a variety of treatments, not only drugs traditionally known as chemotherapy. The treatments you may receive include immunotherapy, hormone therapies, targeted therapies, as well as chemotherapy. Many patients will receive a combination of those treatments, as well as other treatments such as radiotherapy, surgery, or clinical trials. It is, however, important to understand that each treatment is unique to the patient and is based on the type of cancer, genetics, patient wishes, and risk factors. When attending for your first anti-cancer treatment at CUH, we understand you may have many questions. This film will hopefully answer some of your questions and help you familiarise yourself with the terminology you may hear when attending for your clinic appointment.
Prior to attending for your first anti-cancer treatment, you will be reviewed in clinic and have your bloods taken. This is to ensure the treatment is ready for you when you arrive at your first anti-cancer treatment appointment. We will also ask you to get your height and weight taken, which will be used to calculate the treatment specifically for you. You can eat and drink as normal and take your routine medications before you attend for your treatment. Treatments can take from a few minutes to a few hours, so we recommend that you would bring something with you, such as a book or a personal electronic device, to help you pass the time quicker. You're also welcome to relax in one of our reclining chairs or even take a nap, and you can bring a blanket if you feel the cold easily. Feel free to wear your normal clothes or whatever makes you feel comfortable. Snacks are available on the day, and you can make a hot drink at our self-service drinks machine. But feel free to bring anything with you may like to eat or drink. Your first treatment can make you feel fatigued or overwhelmed, and even in some cases drowsy. It's therefore important to think about how you'll get home after your appointment.
The location where you receive your treatment can vary, and it depends on a number of different factors, such as the length of your stay or the treatment type. Most patients will be seen in one of our cancer day units or our GP outreach sites, where treatments are also given by CUH cancer nurses. Other patients, however, who require an inpatient stay will be admitted to one of our cancer wards. This will be pre-planned with your clinical team. We will aim to admit you on your planned treatment day. However, this may not always be possible if other patients have required emergency care. You will be contacted by one of our bed managers who will keep you informed of when a bed is available for you. If you are between 14 and 24 years old, you will receive your care on our teenage and young adult ward, both for inpatient and day unit care. One of our teenage and young adult team specialists will support you with any questions you or your family may have.
Anti-cancer treatments are given in different ways, depending on how they are most effective at treating the cancer. The majority are given through a vein or via tablets. However, there are also other routes. If your treatment is given via a vein, you may need a cannula placed when you attend the day unit, which will be removed before you go home. For some treatments, patients may require a central line to be inserted for the entirety of their treatment. If this is something you need, your treating team will discuss this with you in clinic. The central line allows us to give your treatment directly into your vein. This may be via a bag on a drip stand connected to your central line, or in a syringe, which a nurse will slowly administer directly into your line. These are called boluses. Some treatments are given subcutaneously, via an injection under the skin, or intramuscularly, under the muscle. Others can be given by injection into the fluid around the spine and brain, which is known as intrathecal. Not many patients, however, will receive treatment via this route. Some treatments are taken home in a slow pump infusion via a device that is attached to the central line. If this is the case, you will need to have your pump disconnected when your infusions are completed. The day unit team will organise this for you. If your treatment can be given orally via tablet or liquid, you may not need to attend the day unit at all and will be directed to collect these from pharmacy after your clinic appointment.
All the different types of treatment can cause a range of side effects. The side effects you might experience will depend on the treatment you receive. Some side effects are more common than others, but the nurses will explain specific ones that you need to be aware of on the day of your treatment. We will now go through the most common side effects, and if you have any or something you are concerned about, please always contact the hospital using the details outlined at the end of this film. Chemotherapy can reduce the number of blood cells produced by your bone marrow, causing low levels of white blood cells, red blood cells, or platelets in your body. If any of this gets below a certain level, it can mean you need them replacing with a transfusion. We monitor these as part of your pre-treatment blood test. If the white blood cells becomes low, you're more likely to get an infection or find it harder to fight an infection. It is normal for white cells to be at their lowest 7 to 14 days after having chemotherapy drugs. However, this condition may not develop if you are receiving other types of anti-cancer drugs. You may hear your clinical team refer to a low white cell count as neutropenia. Symptoms you may experience if you have an infection include fever of 38 degrees Celsius or above, feeling cold, shivery or shaking, feeling generally unwell even without a temperature, bone pain, body aches, signs of an infection like a wound, cough or sore throat, breathlessness, diarrhea, needing to pass urine a lot, or discomfort when passing urine. Developing an infection when you have a low white blood cells count can sometimes be a serious complication and could potentially develop into sepsis. Your doctor may prescribe antibiotics and other medications to take if you are unwell from the infection, and you may require hospital admission. As part of helping your body to recover from the infection, your doctor may stop your treatment or delay your next dose. This is not, however, something you should worry about. This is to help keeping you well throughout your treatment. We also ask that you do not take drugs such as paracetamol or ibuprofen regularly, as these can keep your body temperature down and hide the signs of an infection. If you are taking these medications for pain regularly, please check your temperature before taking the drugs. Red blood cells carry oxygen around the body. If the number of your red blood cells gets too low, this is called anemia. If you become anemic, the symptoms you may experience include pale skin, breathlessness, low energy, feeling dizzy or lightheaded. Platelets are the cells that help the blood clot. If you have a low number of platelets, this causes an increased risk of bleeding and bruising. Symptoms to look out for this condition include nosebleed, bleeding gums, blood in your urine or when you open your bowels, a rash that looks like small red or purple spots on your skin. It is important that you keep track of your side effects and let your treating team know if you develop any of them. Some side effects are mild and easily treated, with many well managed by supportive medications. Hair loss is a known side effect of receiving chemotherapy. However, this only occurs when you receive certain types of anti-cancer treatments. For some drugs, it will be a high-risk side effect. However, for others, you may experience thinning of hair or even no hair loss at all. You may choose to wear wigs, scarves, turbans, hats or bandanas if your treatment causes hair loss. Our cancer support team will be happy to support you with any questions you may have or with accessing a wig. Hair loss usually starts within a few weeks of commencing treatment, but you may see some loss earlier, even within a few days of starting your treatment. Your hair will usually grow back over a few months after your treatment ends. You could therefore expect to have a full head of hair after 3 to 6 months after completing your treatment. Some anti-cancer treatments can make you feel nauseous, which can develop into vomiting. If your drugs can cause sickness, you will be given anti-sickness medication on the day of your treatment. You may also be given tablets to take home, which are to prevent nausea or sickness. If you feel sick at home, or if you are sick more than once in 24 hours, please contact the hospital, as there may be other drugs that we can offer you. Please remember that not all treatment causes sickness, and many people will not experience these side effects. It is common for anti-cancer drugs to affect your bowels. They can cause diarrhea or constipation. If you are at risk of this side effect, you'll be given anti-diarrhea tablets or laxatives after your treatment. The nursing team will explain how to use them. Contact the hospital if you have any of the following symptoms. You have more than 4 episodes of diarrhea in a day. You have a stoma and have moderate or severe increase in output. The anti-diarrhea or laxative do not work within 24 hours. You have new incontinence or are unable to pass wind.
A lot of anti-cancer treatment can cause loss of appetite or taste changes. However, it is important to continue to eat where possible. Aim to eat little and as often as possible. We would recommend eating the things that you enjoy. Some foods may taste different or have no taste. However, please try different foods or those with stronger flavors to find out what is best for you. Where possible, increase or add in foods that are high in calories and protein, such as adding full fat milk to your tea, eating ice cream, snacking on nuts, cheese or dry fruits. It is important to eat well during treatment. If you are having problems, ask your nurse for advice. If your weight loss continues or becomes concerning, you may be referred to a dietitian for specialist advice. Chemotherapy can cause mouth problems such as sore mouth or throat, mouth ulcers or infection. You may get mouth ulcers approximately 5 to 10 days after your treatment. Mouth ulcers can become infected or you may develop an infection in your mouth. The most common mouth infection is called thrush or candidiasis, which looks like white spots in your mouth or a white coating on your tongue. It is normal to feel tired whilst having anti-cancer treatment. This is a common side effect but can feel very difficult to manage. Listen to your body and rest when needed. You may find you need to take more naps or decrease the activity in your normal routine. The pattern of when you might feel tired will differ for each drug. However, most people find that it is worse towards the end of treatment and for some weeks after it has finished. The tiredness will get better when your treatment is completed, but it can take 3 or 4 months until you feel back to normal. Some people may carry on working during treatment, and you might find that through some period you feel less or more tired. You may find it helpful to make notes of your pattern and discuss this with your employer so they can support you at work. For all of these symptoms, it is important to continue to drink enough fluid. So try to take small sips often and also eat small amounts of food regularly if you can. There is a group of treatment which can affect the nerves in your hands or feet. This can cause tingling or numbness or a feeling of pins and needles. You can also find it difficult to fasten buttons or touch cold objects. This is called peripheral neuropathy. Your clinical team will inform you if this side effect is a risk to you for the drug you are receiving. If you do have these symptoms, please inform your clinical team so they can support you appropriately. as this can have significant impact on day-to-day life. Usually, peripheral neuropathy gets gradually better when the treatment is finished, but it can sometimes become permanent. These side effects can sound very frightening, but it is important to know that you will not experience them all. There are also things that we can do to help you with managing your side effects. So please let your clinical team know if you have any concerns.
At the start of your treatment, you will receive a red emergency card showing your name, hospital number, and the name of your treatment. The 24-hour helpline numbers included on the card are for you to obtain immediate advice. If you feel unwell with any of the side effects and the medications you have been sent home with are not helping, you should call the emergency number. If you feel generally unwell during your anti-cancer treatment, please measure your body temperature using a thermometer. If your temperature reaches 38 degrees Celsius or above, you must call the emergency line to seek advice, as this can be the sign of a medical emergency and you may require urgent treatment. The emergency triage lines are open 24 hours a day, 7 days a week, and are answered by our experienced cancer nurses who will advise you on your symptoms. Where possible, the team will try to help you manage your symptoms at home, which might be with the support from your GP. When additional support, however, is required, you will be advised to attend the hospital. This may be through our cancer assessment unit or the emergency department, depending on your condition. We aim to keep patients out of the hospital where possible, but at times you may need a short hospital admission at one of our cancer wards.
If you have any non-emergency questions or concerns about your medications or treatment, please contact your clinical nurse specialist on the telephone number provided to you at your first consultation. You may need to leave a message, but they or another member of the specialist team will get back to you as soon as possible. You can also contact your clinical team via MyChart messaging if this function is available within the clinical specialty caring for you. The team will respond to you within 10 working days. For any appointment queries, please contact the number provided in your appointment letter. If you, however, have any other non-clinical questions or concerns, please contact your cancer navigator, the support advisors, or visit the Cancer Support Service Information Pod located in Oncology Outpatients on Level 2.
Throughout your cancer care, you will be closely monitored by your clinical team. This will include undertaking blood tests or imaging, such as a CT scan when necessary. You will also need to have regular clinic appointments, however, some of these will be via telephone to minimize the amount of your hospital attendances. Through your treatment, doctors may also need to make changes to your treatment plan. This could be due to the effects of the anti-cancer therapy on your body or the effects on the cancer itself, or to suit your personal circumstances.
Thank you for watching. We hope this film has helped to answer some of the most important questions about your first anti-cancer treatment. We encourage you to continue to ask questions of all the professionals caring for you, as we want you to feel as informed as possible. If you would like more information about cancer services at CUH, please visit the CUH website or drop in to the Cancer Support Service.